And then the newest exciting thing that I'll keep you guys informed of, and you'll feel hopefully fancy and cool to know this and maybe be able to help somebody. So far, we've been talking about bringing cells in and proteins in to help people. That's, kind of what, if you kind of summarize what we've been doing. The other thing we know is that bringing blood flow to an area, for example, a medial meniscus tear, we know that has terrible blood supply to medial meniscus, diabetic ulcers, things like that, different distal, issues more further out than the core of the body. So now we're starting to look at the other avenue. I equate it to building a neighborhood, Thrive Construction, and you're putting houses, you're putting cytokines and interleukins and proteins, you're putting cells and proteins. But if you don't have the pipelines, the sidewalks and the roads, which are the blood vessels to the area, then no people are going to come. So now we have I've just started using in May, a cadaver-derived billions of microscopic vessels, capillaries, venules, and arterioles. And I'm making that into, it comes in a wafer, and I make it into liquid form, and I inject that right into a tendon or a joint, and it blends with your host blood vessels and creates, what?
That's amazing.
I know, it's amazing. It's called mVasc. M is in mom, Vasc is in vascular. And they basically take a big chunk out of somebody's, subcutaneous, and they take out all the fat and the muscle. It takes a long time to clean it up. It's kind of like a bone fusion, if you've ever heard of people harvesting like a bone allograft and then stuffing it into help a fusion, like your toe or something like that. It's the same concept, but you're using little pipes, little blood vessels.
That's really amazing. I
Yeah,
mean,
it's really cool.
unbelievable.